Welcome to the Tiny Box Dialogues. This series was created to share the knowledge of our experts using real examples from real people with real stories.
Welcome. Today we are speaking to Simon Ross and Julian Molitor. We'll start by introducing Julian. Julian's a co-founder and co-CEO of Invenian, a digital health consulting and solution development firm. He has a vision of developing digital innovations in healthcare sector, but before starting Invenian, he started his own startup, Feto Life Science, in the digital health space. Now, Julian, how did you get involved in healthcare? Give us a little bit of your backstory.
Yeah, first of all, thanks so much for being here. Well, I come from a doctor's family, so I was already involved, basically not based on my own decision. But after spending a couple of years in consulting, where I was doing a lot of digital health projects, I really realized how important this industry is and also what's going to change there in the future. Yeah, and that brought me back to my roots. And then I decided to start my own company, as you already mentioned, because I think there's been no time before where it was so easy to go into healthcare as it is today and so necessary. That brought me into it, to keep it short.
That's fantastic. Thank you so much. Also joining us is Simon, who is Marketing Director of GE Healthcare's Digital Health and Artificial Intelligence portfolio in Europe, Middle East, and Africa. I mean, just the fact that we mention artificial intelligence related to healthcare is super cool. Simon has over 15 years of international experience, and over the last decade with GE Healthcare, Simon is successfully focused on building and commercializing solutions that bring together the entire GE Healthcare portfolio, including medical devices, healthcare IT, digital solutions, consulting, and services. Simon, it's a pleasure to have you back again. How did you arrive here? Why don't you give a little bit of backstory for people who don't know you?
Well, thanks for having me as well. Look, if you would have asked me 15 years ago if I would like to join the healthcare space, I likely would have said no, or would have denied that. During my MBA, I basically want to boost my consulting career to the next level. But then a combination of decisions in my life, partly professional, partly private, brought me to my current company and also brought me to the healthcare sector, which in hindsight, I'm really glad that this was the case, because I believe there are very few industries that are as complex, but also as comprehensive and fascinating as healthcare. And for me, working for the industry with a purpose is actually a good thing. I mean, there are very few industries where you can wake up every morning and you can say, I'm contributing to the broader good, let's say. And this at the end motivates me quite a lot.
That's fantastic. I think there's been a lot of talk about purpose this last couple of years, especially as people have been working from home and shifting their jobs. So I think it's a great thing to say, yeah, I believe in what I do. That's a good thing, right? And I'm sure your parents are very proud of you as well, Julian. We actually have somebody from Siemens Healthineers who's listening in, so hopefully we'll get a couple of questions from there. So let's face it, we're living in a very different world than when you both started. Healthcare has come a long, long way. Now we're looking at an intersection of technology, research, and healthcare coming together. I can't visit LinkedIn without hearing about some new health tech. I wanted to take a moment to define it because it's such a broad definition. The World Health Organization calls health tech the application of organized knowledge and skills in the form of devices, medicines, vaccines, procedures, systems developed to solve a healthcare problem and improve the quality of lives. That's a pretty bucket term, right? I mean, Simon, what is healthcare to you and your organization?
I can give you the corporate perspective here, and your definition already sounded quite complex. You asked me, at the end, in the future, successful health organizations will merge clinical medicine with data science. Think about it. In our sector, there are two very important levels, I would say. One is the healthcare professional, who normally is time limited, and the time is precious. On the other hand, we have a treasure of data points that are generated throughout the care pathway or the patient journey. Data from diagnostic imaging, data from labs, data from the EMR, but also data in the future from wearables, even from social media you could use to improve healthcare, right? Two important facts here. If you see how much time a healthcare professional spends with patients, it's roughly 17%, which is tiny, right? And the rest, they basically are either doing administrative work or they are in front of a computer system trying to find the clue that can help you to improve at the end the patient's care pathway. On the other hand, a hospital roughly produces 50 petabytes of data. I myself did the exercise to calculate how much this would be in the most undigital object, which is a book. That's 80 billion books you would use to basically capture this data points.
No way.
It is. And if you are the doctor that has to find this one sentence in this 8 billion books that helps to improve care, quite difficult, right? So that's where technology, and also technology like AI, comes in. Basically, that's the bridge to bringing together these two worlds. And I believe if we marry these two disciplines, that's where digital tech at the end plays a vital role.
Yeah, fantastic. That's an incredible statistic. Thank you for sharing. Julian, I mean, like you said earlier when we spoke, health tech is quite a broad term. Do you consider what you do, especially at Feature Life, health tech, or how do you define it from a startup perspective?
So, I mean, definitely what we do at Feature Life is health tech, because we are providing an app which helps pregnant women to find their way during their pregnancy and also detect some symptoms using AI algorithms. So basically, in some way, what Simon just mentioned, you know, and also what we do at Invenian, it's really broad. So we, for example, work with like laboratories to use AI to use basically the data that they collect on an everyday basis and do some, for example, drug investigations and all this. And also what we do on a daily basis is, for example, to see what does the processes in hospitals look like, and to use data science to optimize these processes. So basically, from my perspective, health tech is so broad, it is really difficult to define in specific what it means. And that's why I actually like the definition you just mentioned, because it's really a bucket definition, and it allows you to really basically cover everything. And also what I just was working on together with the company, which is Vitonomy, and they are building digital twins, and they use the digital twins to accelerate clinical studies. In the future, it might be possible not to, for example, have a few hundred people in the clinical study, but a few 100,000 people based on simulated virtual patients, based on the data of course, real human people. And this shows, I think, the potential of health tech, and also in which direction it can go.
Well, we know that a lot of progress has been made. What is the maturity of digital health technologies in the healthcare market at this point, do you think? Like, how mature is the market in your opinion?
I mean, in one word or one sentence, not mature at all. I think we have really made a lot of progress. So when you think of telemedicine, I think in the US, we have already 40% of the patients who have used it. Before COVID, it was only 17%. In Germany, I think we are roughly 20% or maybe a little bit less. So still a gap, but definitely improved due to COVID. But when I go to a doctor, like quite often my doctor doesn't really know my full story, because it's not really centralized stored. And I think this is really the basic stuff, and we haven't really put it into place right now, and it's essential to really add the most value. So I think we are not so advanced as we could be, and this is something that should definitely come at the next step.
Excellent. Thank you very much. Actually, that's a funny segue. I'm going to jump in here. I'm a bit of a medical miracle myself. I've had 2 major surgeries. I had a heart aneurysm and have an artificial valve, and I have metal plates in my head from a car accident. And what you just basically said is this holistic view, and being able to explain what all of your different checkpoints are and what you've been through and who's been checking you out and which doctors you've seen. Just telling that story to a new doctor becomes like an exercise in itself. We don't even get to the end of the doctor session, because there's so much information I have to give. And when you mentioned the digital twin, the first time I saw that was at RSNA in Chicago, just before the pandemic, a year before. And I thought, how super cool is that? Even you've talked about it from a research perspective, but as a patient, what I would love is if everybody had this idea, this twin of who I am and what pieces of me are artificial, like where's my metal plates and where's the valve, so that I don't have to explain it, because I'm no medical healthcare expert, and I definitely don't have 80 billion books to look through, as Simon says. So I think this is really important. But Simon, I'd love to get your if you have examples of progress that you've seen of how AI and digital health systems are influencing our healthcare in a positive way. That would be great if you can share that.
I mean, one point that I share with Julian is that it's quite immature. So AI gives a big, let's say, promise to our industry. It says we can improve outcomes, we can elevate patient experience, we can liberate caregivers at the end, and we can do all of that, reducing costs. That's let's say the value proposition of artificial intelligence. If you look into the reality, it's like also Julian mentioned. 95% of this data is somewhere in a store, in the storage, not used at all to improve health. I believe you can apply technically or technologically AI throughout the care pathway, from scheduling over detection in the diagnosis to decision support in the treatment, up to virtual care going out of the hospital at the end. There are use cases in each of these buckets, but are they really working? I would say less so, right? I also believe that there has never been a stronger need for AI than today and for digital technology. Why that? We also mentioned that COVID at the end showed how debil our sector at the end is, right? There's an expected staff shortage until 2030 of 18 million people, predicted by the World Health Organization. You have a backlog due to COVID right now, being 6 million just in the UK, set by the NHS. And basically, these technologies can help to address all of these issues. Having said this, if you look basically how difficult it is to come from a research environment in healthcare towards mainstream practice use of artificial intelligence and digital technology, everybody knows that healthcare is complex, and that the road basically from A to B is a long one and a complex one. So I would echo also what Ewan said. We have technology today, but we are not using it yet, and adoption is still a level we have to figure out.
And adoption would prevent us from gathering the data that we need to improve, I would imagine, the technologies as well. Would that be correct, Julian? I see you nodding your head.
Yeah, for sure. Like it's a chicken egg problem, right? In some way. So, and this is, I think, something where the regulators and policy comes into play. They have to create an environment where we can solve this chicken egg problem in some way. At the moment, I think there is a reason why, for example, Germany, we lag behind. Definitely, there is also a system and a cultural perspective, but also in some way, data security is a problem here. I don't want to say that we should reduce data security in general, but for sure, it hinders in some way some innovation. And we have to ask ourselves, where do we want to go in the future? Do we want to lead this process, or maybe someone else? And then innovations will just come into Germany, and we are not the first here.
Yes, of course, it's never so straightforward, is it? There's always politics involved. I think I heard last year how advanced China is in AI and development of AI, but that's also because the security and the data protection is not there either, right? So it's a bit of a balancing act on how far do we go with the privacy versus how fast can we develop the technology that we need, right? I mean, Simon, did you want to add to that? Sorry, I just give you a chance.
Yeah, for me, the main barrier, that's what you were also alluding to before, Julian. For me, the interoperability bit at this point in time, right? The systems don't talk to each other. It's the first thing. Secondly, we have this siloed data. It's somewhere in a storage, not used, right? And sitting there. I always say, like, a lot of companies at the end are data rich, but insights poor. They don't use what they could do with this treasure they have there.
I don't think that's just restricted to healthcare, to be honest.
I mean, but a second big point I want to make is that I made this example before when we talked, like the integration of tools in the way how healthcare professionals work, or how the patient at the end perceives the care pathway, is very important. This has to happen seamlessly. I always took this example when I traveled this week. I took this kind of scooter from my house to the train station. There I took the train, which was delayed. So I got already a push notification on my phone. Train is delayed, so I could have a second coffee. And I arrived at the gate at the airport afterwards, already knowing where I want to go, correct? And this kind of integration in my private life, it works quite easy, right, when I travel. Try this in healthcare, please. You're not even able to get your healthcare data from your private practitioner to your final doctor. That's the example you gave, Raj, right? That's the second big point, this missing integration into the workflow and the way of working. And the third big one, I believe, which is also a barrier today, is there is still a general resistance against this kind of technology. And especially doctors have a good point here. They pledged to save lives and to protect lives. So you don't want that this technology is not 100% bulletproof. So there could always be a second study on proving that it's working, right? And I would love to see that as well before I use a new technology. Last point to add on all the points that we had before is we didn't really figure out how the value exchange, the reimbursement, the payment for these technologies are happening. That's also something, if you don't pay for something, normally it's not really applied and adoption will lag. These are the points that I would add to the barriers mix at the end.
And one thing I want to add, because sorry for interrupting you, Raj.
Please.
I really liked every single point you mentioned, Simon, especially also this data interoperability thing, where I would fully agree. And also one thing I want to add, it's not always a question of technology, but also a question of concepts, you know. At the break, we have the technology, but quite often we're missing the concepts. And what Simon gave as a good example, this travel example, you know, we should come up with good concepts to bring the technology into healthcare. And then, of course, it's a question of reimbursement, of openness of the individual counterparts and players in the system to these new concepts. But I think also thinking of the concepts, not only of the technology, would be really important.
So the use cases, you mean? So
Exactly.
how exactly do we want to use this technology, and how does it make benefit? I often hear people talk about AI and technology and implementing it before they've even determined what the root cause is of what they're trying to solve. And that's kind of what you're talking about with the challenges and drivers of development of healthcare technology. Julian, I mean, you have this insane ability to check in with your parents who are doctors to see how they would be motivated to use such a technology. I mean, is it that we have to wait until there's more acceptance to change the status quo? Do they see the benefits of where this could be useful? Because I mean, just as an example, I went to a doctor just last week and I'm still filling in a form. Now, this is the 5th time that I've seen the doctor. Why am I still filling in a form with the same information? Simon, you alluded to this earlier. So what is it that's the barrier for, let's take it from the doctor side first, because we know there's a privacy data issue from the individual side, but what is it that you think would change that status quo for doctors in the healthcare system? Because there has to be a determination of change to change the status quo, right?
Yeah, I think first of all, there is a big disconnection between, on the one side, like the innovators, startups, us who are speaking about these topics, and the ordinary doctors. Because the doctors take care of the patients, they have different things in mind than thinking of AI solutions and new innovations, you know. So I would actually say my parents even don't know of many good solutions because they just don't care about this so much in everyday life, you know. So they also don't see the value of it. And given that they don't see the value, they are not so motivated of bringing in new innovative ideas into their daily life. Secondly, as Simon already said, they're not paid for this, you know. So if I work for my patients and if I get paid for curing my patients, why should I spend additional time to look for innovative solutions that I can bring into my everyday like doctor's office, you know?
Have we seen successful uses of technology where it has made a difference in saving lives or like doing something that a doctor can't do? I think one technology I saw was that the AI was more accurate in diagnosing a cancer cell than a human eye would be looking at the same report. So is that not a motivation there, that we could save more lives?
I think in oncology and radiology, it's definitely a huge use case, and there people have seen it. I think these doctors also have already started to adapt this decision support systems in everyday life. So I would say this is a good example you brought. But in maybe primary care, it's not it didn't really arrive yet.
Yeah. Simon, do you have any examples of things that you've seen that have progressed?
I mean, there are some good points here. For me, for example, whenever you evaluate a technology like artificial intelligence, it helps to ask 2 questions. First, where is it used? Julian said this, in which specialty? And then what does it do actually? And if you look back right now, let's say all the clinical artificial intelligence was the sexy stuff. This got the headlines in the newspapers and so forth. So if you take PubMed, which is a database that publishes research papers on AI, the majority fall into, I think there have been 13,000 publications last year. They fall into mainly 3 buckets. One is pathology. The second one, or oncology, the second one is radiology. The third one is surgery. Why is that? Because most of the data is generated in these exercises, right? So if you want to have a clue where it's used, it's where most data and maybe also the most openness to change, like George's always worked with digital tools. is happening. Then the second question is, what does this AI do for you, right? And there the main use cases I see is triage, telling somebody, it's a concept coming from the Civil War in France, saying this patient is severe sick than the other one, so treat him or her first. The second one is decision support, so helping you basically to make the next decision based on data in your care pathway. The third one is it augments your capabilities. You made this example that can be very specific. The human eye can see 50 shades of gray, more or less. When you get older, in my age, it gets already less. A computer can see more than 250 shades of grays, and it's not getting tired. There's no difference in kind of quality and time of day when a computer works right. So there is an advantage in that, which we call augmented, let's say, reading. It helps, it gives capability to the healthcare professional that he or she doesn't have normally. Always being a symbiosis, not one or the other. And the fourth big fact is it automates redundant tasks or very easy tasks like reporting. If you ask me, it is not fair that, for example, all this sexy stuff like detecting cancer gets all the headlines, because I believe the bigger lever is at the end in this operational improvements you can achieve in scheduling, for example, right? Telling that Simon is not going to come to an exam at 6 in the morning because he likes to sleep long. A computer can figure this out having the right data. And there's a little bit, I think there's a bigger lever, because if you see, and I'm a freak of statistics. The OECD said, I think 2 years ago, that 20% of the healthcare spending is wasteful, but that's not in the detection of cancer. That's more in the scheduling and the processes where you can.
But it's not as sexy, so nobody talks about it, right? It's not. I mean, nobody wants to hear about scheduling being the issue. It's rather that you didn't try to figure out what my disease was, right? But actually, the scheduling has such a huge impact on healthcare for everybody. I mean, NHS clearly has lots of issues, and I guess that's the next thing I would come to. And then Julian, I will have a question for you. Is clearly all of what's been happening this last couple of years from the pandemic onwards must have an influence on what you're focused on within the healthcare sector, does it not? I mean, the fact that we're not traveling as much and that we have this crisis again. What impact has that had, the pandemic, COVID, et cetera, on where the focus has been? Because like you said at the beginning, being able to triage, being able to see the people that needed to be seen when this hit us was a big issue. And then, of course, the second issue was the vaccinations were not going out to necessarily the right people right away, and there were people waiting for a long time. So how has that influenced what you're doing in the healthcare system?
I mean, this is a broad question, because on the one hand, what we saw in COVID, we didn't only see what it meant to us and how we operate in the healthcare system, because this is something what Simon just mentioned, for example, scheduling a doctor visit, having telemedicine. This is something that has definitely changed, that has increased, improved, and new solutions have basically brought into the game. But also on the science side. So, for example, we have some the best vaccinations ever, because of AI solutions. That's the only reason why we were able to create vaccines within months, and because we could simulate this by means of AI, could create the molecules and also create a vaccination based on RNA, which has never been done before in this way, And now I think it brought attention to the space. It brought also money to the space. And now I think we basically kicked off a process which will continuously accelerate itself. This is really important. So we have to, on the one, the operational side, on the other hand, we have like the science side. And also, I really want to take the opportunity to also add one more point to what Simon just explained, where basically we improved, or where AI will improve in the system. Something that's important, and it's not only related to AI, the health tech improvements will also mean that we as humans can actually do more of the healthcare ourselves. We can track our own health, and this will reduce a lot of time the doctors spend for taking care of healthy people, because we go to checkups, let's say every 3 months, 6 months, whatever. I can actually check myself on a regular basis, track my own data with my smartwatch, and whenever there's a problem, my doctor can know it. But if there is no problem, no need for me to go to the doctor, And then the doctors can really focus on what's most important to take care of the sick people.
Amazing. That's actually a very good point. I mean, there's a negative side to that too, because people are trying to self-diagnose when they're sick and think they know what's wrong with them, and it's creating more symptoms than actually what was present. But I think you're right. And I mean, that's one thing I do love about having a smartwatch, is that I can track my heart rate, etc. and having had heart surgery, this is really kind of a comfort, right? Simon, did you want to add to that at all?
I mean, look, the virtualization of care is a big one. This hospital without walls, for sure, will happen. I actually see a convergence between healthcare, fitness, and wellness. Somehow they all do similar things. And healthcare was very much, even if the term healthcare is maybe wrong, it was completely focused on the sick care part of things, getting people, basically treating people there. But if you put fitness and wellness into it, you can actually move towards prevention and so forth. So that's a big mindset shift I see on both in patients, I believe, as well as in doctors. The best example is teleradiology or teleconsultancies. It was always deemed that it will not work. For years, people said like, no, I need to talk personally to the doctor, and so on. I believe in severe cases, this is still like that. You don't want a machine telling you that that you have got cancer. But I could live with getting my blood results, say, okay, via WhatsApp. I would have no problem with that, because if security at the end and data privacy is applied, I would basically be fine with that. So there's a mindset shift towards using these tools. Like I explained, I use every day in my consumer life, also in healthcare. That's hopefully one of the big movements we see with this pandemic, that people are more on both sides, healthcare professionals as well as patients, are more willing to use these tools and are more getting part of the healthcare journey, as Julian said. I would actually literally use the term consumer here, because sometimes it's not, and it's bad to talk about consumers in healthcare. I would,
but we are.
In some cases we are, right? And if you take an empowered decision and you are smartly connected, why not?
Absolutely. It brings up such a simple use case where and I live in Munich, as you know, I have to go to the doctor to get my prescription. I've been taking these pills for over 25 years for my heart, and I still have to go to the office to get a handwritten signed prescription, then take it to the pharmacy. I totally get it. Just simple little things that you feel should be automated at this point. But as you said, there's many barriers and challenges to that. We have 4 minutes left, and I wanted to give you both an opportunity to share a final takeaway, or what you hope for the future of healthcare, or trends that you think we should be watching out for. So if you would like to take a couple of minutes and just share what your insights are, that would be fantastic. Whoever wants to go first.
So maybe I like to start, Simon, if that's okay with you. I think I see 4 points which are important. First of all, digitization will come. I mean, there's no point for this. And some people are still hesitant to go this way, but it will come for sure. Secondly, I think most important, we start from the same point, everyone. And that means, of course, some big players in the market have some understanding, some insights and so on, but they also have a big legacy burden they have to bring. So startups can really disrupt the whole system. Third point is everyone, like patients, have also to be willing to accept the new solutions. And the last point, which we even didn't discuss in this webinar or podcast, I think we also should think of the emerging markets. I mean, what does it bring to countries without any healthcare system if they can use their iPhone or their smartphone and do all this via telemedicine? Huge improvement, and I think this is quite important also to see when we think of digitization in healthcare.
I love that, because actually I was really surprised at how far we've come in terms of doing remote surgery, where you send the equipment to third world country or emerging markets, and they have a doctor in California at one point doing the surgery through this. It really blows my mind how far we've come, but that's a very good point regarding the emerging markets. And Simon, would you like to share your insights?
I mean, if you look where healthcare should go in the near future, for me, it has to be patient-centric more than ever before, and it has to be precision-oriented, because you can, with the data points, go to the individual, not to a collective. It has to be digitally enabled. That's the example I gave before with this kind of transportation, let's say, journey. It has to go virtual. That's what I mean by that. And it has to be data-driven. That's what I believe has to happen. And AI is a big driver of that. But AI is only as strong as the human experience or the expertise it supports. Yeah. Right? That's an important point. Innovations always have been need-driven rather than technology-driven. You said this before as well, Julian. It's at the end the person and the mindset change that has to happen here. And I believe we only make this work if we work together as an ecosystem. And this means involving the patient early, involving the users as much as startups, as much as any kind of, let's say, patient association, but also the corporate have to be more open to work together and not work always with their kind of blinding spots like that. And that's what I believe would help that hopefully this industry gets a little better.
You know, we actually had a question from the audience that was about the expectation that you would have for the healthcare professionals, but I believe you just actually covered that in terms of are they the users or professional advisors to the patients and on how to correctly use the AI. But I think you both answered that in a different way in terms of there has to be the user who accepts this new technology and the way that it works and take control of their own healthcare. And then, of course, what you just said, Simon, about there's an acceptance that needs to take place on the other end. If you'd like to share any, I will share the rest of the question with you after the fact. But thank you so much, because I think that this was a really important topic. Next Wednesday, I'm actually speaking to somebody about healthy work environments and the impact of social and corporate culture on mental health with our expert, Sam Gibson-Massey. So I feel like that kind of leads into what we're going to be discussing next week, which is fantastic. So there you have it. One day healthcare will work as well as travel, hopefully, with a full picture of the person, all the information at our fingertips. This audio will be shared on Spotify. The video will be shared on YouTube, as well as information on where you can follow these great speakers and experts on LinkedIn. So thanks for joining, and see you online next week. Thanks, guys.
Thanks a bunch.
Thank you.